here we go. Okay, looks like we are recording. So again, if you can turn on your cameras, ask questions. You know, you guys have done this before. So we are live with Jane and Jody. Only Jane is not with me today. She is taking a much needed mini vacation. So welcome to our segment today. Let me go over a few things. I'll introduce our guest here. So as a lot of you already know, my name is Jody. I am one of the advisors here at SCNM, along with Jane. So I work with the beginning of the alphabet, A through L. Jane works with the end of the alphabet, M through Z. But we do the exact same thing. We're advising students on taking prerequisites and getting ready to start this amazing journey. We'll be talking to Allie and Debbie today. Allie more on the alumni side of what happens, and Debbie more on the career side of what happens as you're going through the program. Okay, a little bit about me. So I have been with SCNM. I just celebrated my 16th year. So I've been with SCNM for a very, very long time. I absolutely love what I do. Originally from South Bend, Indiana. I moved out here, my family and I moved out here about 20 years ago. Absolutely love it. Love the heat. Love it this time of year because it is starting to cool down a little bit. And when I say a cool down, like 100. So, but that's cooling down for us. Absolutely love the Valley, love SCNM, love this profession. Can't imagine doing anything else. I'm originally from the mortgage industry, which is a very, very stressful business. So this has been a complete joy to be part of. So welcome to today's segment. Let me introduce our guest here. We have Allie Chappell. So Allie is originally from Malvern, Pennsylvania. She completed her undergrad degree at Westchester University of Pennsylvania. She graduated in 2008. She started SCNM in August of 2019. Her hobbies consist of yoga, traveling, and exploring places with her husband and her pup, Otto. So I always like when we involve the pups with our bio. Debbi Taylor is our career services manager. Debbie grew up in Cherry Point, North Carolina as a military kid, completed her undergrad in 1995 at University of North Carolina, Chapel Hill. She completed her graduate program at San Diego State University. She has a degree in international relations, a master's degree in exercise physiology. She started SCNM March 2021, and her hobbies consist of Japanese culture and food, running, strength training, and spending time with her golden retriever, Parker. Awesome. Welcome, ladies. We appreciate the time that you've devoted to spend with us. As you all know, I do go over a core value, or I pick a core value. Core value, of course, are, core values are the way that our program is fulfilled. So this time I picked We Do the Right Thing. SCNM continues to work hard during this time as the pandemic still lingers on by gradually bringing students back onto campus slowly while still delivering quality education, whether it is online or on campus, as well as delivering effective patient care. So we love that core value. We have 5 core values that we share within the institution, and We Do the Right Thing is one of my favorites. So without further ado, do you ladies have anything you would like to add to that you've already shared with us, or do you want to just get right into it?
I think you said it all, Jody, on my part.
I mumbled a couple times, but that's okay. All right, so to the audience, please remember, this is an open forum. This is time for you to ask questions. Hopefully you have a list of questions. I do have some canned questions that we start out with. But there again, and these are questions that have come to us from prospective students just like you. But definitely you can put your question in the chat, or you can turn off your microphone and ask a question of these ladies whenever you'd like. This is definitely kind of laid back and open to whatever information you're looking for. Okay. All right. So as far as Allie and Debbie, I figured what we do. At first, I was going to separate these questions, but I think it's best that I will ask a question and then you guys, if you both want to answer it, if one of you wants to answer it, it's entirely up to you. Okay. Fair enough. All right. So I'm going to start off with, do you feel it is important for a student to shadow an ND? And if so, why?
All right, so I'm going to go ahead and answer that question. But first, I wanted to see how many here have already shadowed an ND. Awesome. And then do you have any thoughts about why it's important before I go into my little spiel?
I thought it was important. It's kind of what got me into it. I was going to grad school for nutrition until I went to go shadow and get it in a holistic type of vibe for a job. And that's when I actually discovered naturopathic medicine, and kind of seeing what she did is what made me apply for the school. So it was a huge part of me coming here.
Awesome. Glad to hear that. Anybody else?
For me, it's more so I can see what modality drew me in. I felt like I was always exposed to all parts because of my culture. So I just wanted to narrow in on whether it's botanical medicine, whether it's hydrotherapy, or something within the likes that my naturopathic doctor was able to apply to the community and be successful with it too.
Wonderful. All right, anybody else? All right, so it's not just important, it is very crucial. You need to shadow or observe other naturopathic doctors to experience the medicine, gain exposure to different areas of medicine, learn firsthand about the business side of practicing medicine, and then developing connections with practitioners in your field and potential opportunities for jobs down the road as you approach graduation. So shadowing an ND, I feel, is very important, especially as a prospective student.
Awesome. And also, Allie, Alyssa put in the chat, I agree, definitely think it's important to see how NDs differ from other specialties as well as gauge different business models. So absolutely. Exactly. And us as advisors or admissions reps, one of the things as we're going through that advising model, one of the things, if somebody has not shadowed or experienced the medicine, we will highly encourage a student to do so. It's not a requirement, but it's definitely going to help you understand what this is all about. Debbie, do you have any other feedback as far as on your point of view?
You know, I thought what Allie said was perfect. I will have some tips later as we go through the questions, but I love what Allie said. Perfect,
perfect, perfect. So here's a question I get a lot from my students is, how would a student go about finding an ND to shadow in their area? That's a huge question.
That would be my department. So I am happy to set you up with an alum in your area. If we don't have an alum in that area, I can always find you an ND that has graduated from one of our accredited naturopathic colleges and universities. So all you have to do is send me an email, let me know where you are, the area, and then I'd be happy to help.
And Allie does get quite a few emails from Jane and I, because even though somebody like me that's been with SCNM as long as I have, you know, I kind of got a really good idea as who's graduated, who, you know, is in the program, but I still rely on these two departments to help me find somebody for a student to shadow. I mean, you know, the docs, once they graduate, they pass their boards. It seems like, you know, they may be in Arizona and you think they're in Arizona, but no, they're on the East Coast now. So they do move around. And it's these two departments that really stay on top of where are our alumni or alumni of this profession that has graduated from maybe NUNM. Where are they practicing? So these are the two departments that you want to definitely connect with to find that out. So, and do both of you guys, you and Debbie's office, both work together with fun? Because sometimes I know I have emailed Debbie, sometimes I've emailed Allie looking for an alumni. So I'm assuming that you both work together to help students find a doc to shadow, right? Okay, very good.
And yes, oh, I was going to just expand on that a little bit, Jody, if you don't mind.
Absolutely, absolutely.
So absolutely, we work together. In fact, the Career Center and the Alumni Relations Office work together very closely on a lot of different initiatives. Certainly one of them is finding ND connections for prospective students or current students, and even for alumni who are wanting to further connect after graduation. So what I want to tell you all is, as prospective students, if you do want help connecting with an ND, certainly you can go directly to Allie if you like. You can also schedule an advising meeting with the Career Center, which I would absolutely love. I think it would be wonderful for you to be proactive and to start that process. So basically we would have a very informal conversation about your location, about your specific interests in naturopathic medicine. It's an opportunity for you to ask me questions and get this important conversation started about your future as a naturopathic doctor. From there, I would work with Allie. So we both have working lists of alumni connections. She certainly is our alumni expert. That's her wheelhouse. But I would work directly with her, come up with a list of connections for you, and then follow up with you as a prospective student. And then you would reach out directly to the ND. And I certainly have a lot of tips and can help you with your approach to reaching out to the NDs. Anyhow, I'll stop there. Thank you, Jody.
No, very good, Debbie. That's a good point. I had another question in my mind. Oh my goodness, I can't believe. So, okay, so as Jane and I are advising these students, how soon would you think it is a good idea for a student to reach out to you? Can they be like before they even start, or wait till they start, or when's a good time frame for that?
You can absolutely reach out as a prospective student right now. Even if you're early in the process, I would say the more information you have, the better. Knowledge is certainly power. As an enrolled student, I always recommend that a new student meet with the Career Center, certainly in Q1 or even during orientation week. But please don't feel like you need to wait for any reason if you want to start the conversation and be very proactive. I love that.
Very good. Very good. That's good to know. Any questions so far from anybody? Feel free to just ask your question if you'd like. So let me go on then. So here's probably my toughest question I get from students. So what if a student is in an unlicensed state? What does that mean as far as an alumni being available? And I get this all the time.
Sure. So this is a tough question. And if the question is very specific, like if a student lives in an unlicensed state, whether they're able to practice in that particular state, practice naturopathic medicine. And maybe the question is two-part. Maybe it's that question as well as, are there alumni that you can connect with? I think maybe I'll start with the easier part first. Yes, there absolutely are alumni, certainly depending on the state, but we do have alumni who are practicing and working in unlicensed or pre-licensed states. Now, let me go to kind of the bigger question here, which is, are you able to practice? So again, this depends on the state. And I want to start out by stressing the importance of newly graduated NDs obtaining a license in a regulated state. So regardless of whether you're planning to practice in an unlicensed state, you absolutely should become licensed in a regulated state. So this actually upholds the level of professionalism for NDs in that pre-licensed state. And it certainly adds credibility to you as you're working in that unlicensed state. So a little more information. If you are from a pre-licensed state and you want to return to your home state after graduation, you can successfully work as a natural medicine consultant. Consultant is the key word in a pre-licensed state. So if a patient shows up with a diagnosis, you would suggest natural therapies such as nutrition, botanicals, and others to support their health concerns. So I also want to say, in an unlicensed state, you cannot diagnose or treat illness. You also can't refer to yourself as a physician, as there is no scope of practice. However, you may be able to work side by side with an MD or DO who can authorize diagnoses and treatments. Another thing to consider is that you could obtain another license as a licensed acupuncturist and practice naturopathic medicine in a narrower scope of practice. I hope I said that word correctly. And if any of you here today want more information on this topic, because that was a great question, Jody. I'm sure many prospective students wonder about that. That's why you're asking. So if any of you want to talk more about this topic, please feel free to send me an email. You can email me directly at d.taylor@scnm.edu. We can put that in the chat or send it to the attendees after this event. I have a document that was published by the AANP, that stands for the American Association of Naturopathic Physicians. That is our national organization or association. They have a wonderful document that basically provides the do's and don'ts of practicing in a pre-licensed state. So would love for you all to have that if you'd like to take a look. So thank you. That's it on that topic.
I'm putting both of your contact information into the chat, so these guys have it.
Thank you, Jody.
And I know the whole license scenario can get kind of tricky. But again, that's what these guys are here to help you find that doctor in your area that you can refer to. Now, I do know, and I don't mean to go on about this, but sometimes I've been asked from a student, okay, if I go back to Michigan, which is my hometown, and it's not a licensed state, why would I do that? Do you want to answer it, Debbie, or I can answer it based on what I normally tell a student, and you can elaborate on that? You want to do that?
Sure, you go ahead.
So if a student were to ask me, my home's in Michigan, it's an unlicensed state, why would I go back and practice there? I've always told them, the more naturopaths that you have in an unlicensed state, the better chance of that state becoming licensed. So is that true, Debbie? I mean, I'm assuming I've been telling them that for a long time.
Absolutely. That, you stole my answer. No,
Okay.
Jody, absolutely. I think you all should think of, if you were to, say your home state's a pre-licensed state, or maybe it's not even your home state, you're just drawn to that area.
Yeah.
You can absolutely be a part of the advocacy efforts for that state. And, you know, it does take time. It certainly takes a lot of initiative on part of the NDs who are involved, like in that effort, but it's happening. For example, Wisconsin is our newest state. They actually, it will be about another year and a half before NDs can actually obtain licensure, but they are considered now to be a licensed and regulated state. They're just in this in-between time where they have to get their statutes in place and basically get ready for that process to begin. So a lot of exciting things happening on that advocacy front.
I was gonna say, and one of our alums was very involved in that as well, of getting Wisconsin licensed. So yeah.
I think when I came on board here 16 years ago, there were 11 licensed states. And I believe there is it 23, 24?
You know, I feel like the number's higher. I don't know why I'm thinking of 26.
26, and it might be, Debbie. I mean, you know, we get a licensed state. Dr. Mittman usually sends an email out and we're all excited. So I've probably lost track. So, but 11, so we've doubled at least where we were when I first started. So.
Right. And, you know, I also wanted to just add that the AANP, American Association of Naturopathic Physicians, if you haven't checked out their website, you absolutely should. They have a wonderful map of, basically it's like their map of regulated and unregulated states. And then on top of that, you can actually look, because not every state has the same scope of practice, even for those that are regulated. So you can actually click, they have these different options for maps, like which states allow injection therapy, which states allow this and this. It's just a wealth of information. It's also an association that we recommend that you become a member of. Maybe it's further along as a naturopathic medical student, but certainly if you wanted to join in year one, that would be incredible. I know that they have reduced rates for students, and a lot of the naturopathic medical associations for states have those reduced student rates. And actually, I would say join your state's naturopathic medical association. Maybe that's the first step, and then the national association. But that is a wonderful way for you to learn more about naturopathic medicine in your state. Now, assuming they have one, they don't all have those state associations. Also, it's great for networking and just learning, becoming involved.
Is it AANP.org or .com, or do you know what it is? I was just going to put it in the chat for everybody.
I can tell you real quickly. Let me see. So it's actually it's naturopathic.org, and it has the HTTPS, the colon, and then the two forward slashes. But if we somehow don't have that URL right, if you go to Google and you type in AANP and then naturopathic, it will bring it up, because if you don't add naturopathic, you'll go to a nursing association.
Yeah. I've done that a couple times.
Yeah, I've done that more than a few times.
This isn't what I want. So say there's not an alumni in a state, just say, is it possible to interview a doc over the phone? And how would a student go about doing that? Just picking up the phone? And I mean, do you ladies help them with, okay, finding an alumni as close to them as they possibly can, but then calling them? Is that possible?
Yes, and I was going to say, Allie, do you maybe want to talk about finding connections? And then I'll take on the part about interviewing the ND over the phone.
Okay, perfect.
Yeah. So like I said before, all you have to do is reach out, send me an email. My contact is in the chat. Just let me know what the area and the state, and I will try to find, you know, an ND in your area for you to interview. And then from there, Debbie will have some, before you contact them, Debbie will have some tips on how to interview them, or even what you want to say in your email when you reach out to them.
Great. So that actually takes me to my tips. Thank you, Allie. Okay, so here are a few tips for you all. So you can contact the ND by phone, by email, if you happen to have the email, even LinkedIn. And you want to request a time to have what's called an informational interview. So basically, as the name says, you're really interviewing them for information. It's not like what you would think of as a typical job interview, obviously. And it's very brief. You're going to ask for maybe 15 minutes of their time, because you want to be very respectful of their time and their busy schedules. So before you actually, let's say the phone meeting is scheduled, before you actually have that meeting or that call, you want to be sure to research the ND as much as possible. So get online, look at their LinkedIn profile, read about their practice, you know, see what else you can find out about them in terms of their involvement as a naturopathic doctor. Maybe they're involved in the state association and they're involved in advocacy efforts for that state. Also, once you are, well, this is also another part of the prep. So you also want to prepare a list of questions. You know, this will show that you are thinking of this as a very professional meeting. You're prepared, you know what you want to ask. And so you might ask some very basic questions, and some might be more detailed, like, what do you like most about practicing naturopathic medicine? How did you decide to focus on these areas of naturopathic medicine? Let's say if this is a ND who has particular focal areas, or maybe they're specializing in a particular area. Also, this is an opportune time for you to express your interest in shadowing or observing that ND. So you could say, gee, I'm really interested to know, do you allow shadowing? I am very excited and really wanting to learn more about this naturopathic medicine. And would that be something you would be interested in discussing? So those are just a few examples of questions. Can you all think of other questions maybe that you would want to ask an ND if you were interviewing them?
So can I throw one thing in?
Sure.
So even if they are say that they don't have availability for shadowing opportunities, ask them if they know anyone who does, or if they could recommend someone. I think that's another good thing to add to that.
That's a great suggestion. So, okay, I'm going to maybe phrase this a little differently. What would you like to know from a naturopathic doctor right now? Are there any burning questions? So put Jody, Allie, and me aside. Let's say we have an ND in the house. What would you want to ask? Any thoughts?
I was very curious how some of them grew their business mindset and where they obtained their knowledge from. So like I've always asked questions surrounding did you take was it a career change, or what did you do aside from just being within the medical school itself to develop that knowledge on how to carry on your own practice? And who did you shadow for that if it wasn't another ND practitioner?
That is a wonderful question.
Great question. Yeah.
That's a great question. Also, I will say, kind of tagging on to that, when when you have the opportunity to shadow, not only can you observe what's happening in that medicine sense, but also be watching the business operations side of things. That is so important for you, as you might have aspirations to have your own practice down the road. And we always encourage students who are doing observations to, observe and absorb as much as you can in those realms. Thank you. Is it Lakita? Did I pronounce? Okay, thank you. That was, thank you. That was great.
Thank you. Thank you.
Thank you. And anyone else?
Yeah, I've actually had students say to me, but I don't have a business degree. And you don't need a business degree, but you have to, like Debbie said, you have to focus on what the ND is doing and ask questions about their business and running a business. And I've been told that that's probably harder to do than being the actual doctor. So, so that's a learning experience in its own. Yeah.
That's right. I will say that we do have some classes that are built into our ND program curriculum. I mean, I think that it's kind of like business light. We have four classes that are called practice management courses spread throughout the program, and they will give you certainly some knowledge, some business knowledge, but I think really probably the most maybe beneficial way to gain that knowledge is directly from the NDs that you're shadowing and talking with them, networking. That's all stuff that Allie and I can help you with.
We also just have I have something to add too, and you can find this on my SCNM. The Alumni Association has actually started a podcast series called Alumni Business Buds. And so what they do is they go in and they interview alumni, successful alumni, and they tell like tips and tricks of what they did to build their practice. So you can actually find them. We have 2 episodes so far. We're going to have a 3rd one coming out. But you can find that on the My SCNM alumni board page. You can see the first 2 episodes. So that might be something cool to check out.
Thank you. And I actually just saw a recommendation from Dean, who is here with us, a book that you can check out for help in this area of growing a business. So thank you. I'm actually want to make sure I write that down. Thanks.
Very good. So ladies, let me ask you, is there a benefit for you to go into private practice versus with another practitioner, or what do you feel about that?
So I would go ahead. So I think it depends on the individual. It's so important to have a network or mentors, whether you're going into like a residency, solo practice, or a group practice. For solo practice, if you have a clear vision for yourself, your practice, a business plan that's been reviewed and approved by a financial advisor. Also, if you're in a good position financially or financial support, these are if these systems are all in place, then this might be a good opportunity for you for solo practice. But also if you're going into a practice with another practitioner, some benefits are mentoring and support and financial stability. It could set you up for your own practice down the line. And it would also help a new grad build confidence to evolve and figure out what kind of naturopathic doctor you want to be. I've actually heard from alumni, they go into a practice and they'll be in with a patient and something will come up that they're not 100% sure how to handle. And so they have mentors that they can go and talk about it with, and then can come back to the patient. So it just depends on, it just depends on you and your situation. You guys have any questions on that?
Awesome. I totally agree with that. I definitely agree. not everybody's cut out to have a boss. You know, some people like to be an entrepreneur. How many entrepreneurs are in this world? Tons of them, you know. So yeah, I would never be able to be one, but you know, but yeah, so definitely. So let's talk a little bit about residency. Is residency required for a naturopath? And if not, why?
So Jody, I will take this question. So residencies are not required for licensure and practice except in the state of Utah. So in fact, it's important to note that we don't have residencies in naturopathic medicine that are available for all of our graduates. And as an estimate, we have probably about, in terms of residency seats available, about 25%. This would be for 25% of all graduates for all accredited naturopathic medical schools. So certainly keeping that in mind, you know, it is something that I think you certainly should strive for if it's something you want to do. And I can talk more about, you know, why you might want to do a residency, but, you know, keep that in mind too, that only in the state of Utah is it required. And certainly there are plenty of ND graduates who don't do a residency and are incredibly successful, and they find other ways to basically gain or obtain mentorship. Mentorship is the key word here. And I can talk more about that if you want me to talk about the why, Jody. Okay, so I think this leads to the question of why someone would want to do a residency. And I know a lot of our answers have been, it depends on like the state, or it depends on the student. And it really does depend on the student here. So I will say that many NDs do elect to complete residencies for 1 to 3 years before they set out on their own. So basically, the residency, it's a postgraduate opportunity after graduation, clearly, that is going to provide the mentorship, more patient interactions, more exposure to pathology, more teaching experience, more research experience, depending on the particular residency. So it's certainly seen as being invaluable in terms of furthering your clinical expertise. I also want to highlight that it can build your confidence. I know Allie had touched on this earlier. When you are fresh out of school, well, you know, certainly we want you to be confident. You know so much, but it's normal for there to not be that confidence that would be there 3 to 5 years later because you're just getting your feet wet. So residency allows you to build that confidence to turn to others who can help you grow, who can help you determine what type of naturopathic doctor you want to be. So regardless of whether you do a residency or not, whether you join a group practice or start a solo practice, you need a mentorship network as a new graduate and practitioner. This might be a network of mentors that involves other NDs that you can look to for clinical advice or collaboration discussion. It could be a financial mentor who is helping you grow your practice, but just remember, you can get mentorship in other ways. It doesn't have to be a residency, but residency is a great way to get that mentorship.
Well said, Debbie. Definitely well said. I think it's just that confidence builder, and you know, I mean, you graduate, you're ready to go into practice. That's got to be scary, you know, but you do, knowing that you have that doc down the hallway that's been in practice for 25 years. That still may not know all the answers, but I'm sure they know a lot. So yeah. I
Right.
do know the residency, and like you said, Debbie, the residencies are very competitive though. So, and it's an interviewing process, right?
Right, so there is a lengthy application process involved.
Okay.
A lot of materials that you have to pull together just for the application. For example, your CV or curriculum vitae needs to be in tip-top condition. That's something that I help a lot of our students with. I even help graduates beyond graduation with their CVs. Also, a personal statement. You have to also answer a number of essay questions. You have to gather faculty evaluations, which is basically having 3 faculty members complete an evaluative form for you. Your transcripts, your NCLEX 1 scores, so much. So you really want to start the process, certainly not a month before your materials are due. And then once you apply, I mean, there's a very structured process in place that's outlined. I actually want you all to write this down, and we can put it in the chat. If you think that residency is something you want to learn more about, go to the AANMC's website. AANMC. They have a great section on postgraduate naturopathic medical residencies. When you go to that page, you'll find the timeline for the residency match process. You'll even see the CV guide that is recommended for completing your CV. There's FAQs. There's also previous webinars. Those are great to watch. So the AANMC will have webinars. Also, the Career Center and Alumni Relations will host webinars on residency that will help you. So there's plenty of time to learn about this area, but you can start learning right now by going out to the AANMC's website. And if you have any questions now too, I'm happy to try and answer any residency related questions.
I guess one of my questions would be, because like I've spoken to students who are in allopathic medicine and they describe their process when they're not matched. What would the process be for ND students who don't match into a residency?
That's a really good question. I love your questions, Lakita. So actually there's still an opportunity to get a residency if you don't match. What happens is basically those unmatched residency positions, they become jobs. And so our residency director, who is also a part of the board of residency directors for the AANMC, would send out, or maybe I would send out on his behalf, information on how to go about that process, which is basically like applying for a job. It wouldn't be as an extensive application process, but you would likely still have an interview. So it's more like a standard job interview or application. So that's very good to ask about that. Also, there's a standard schedule for most residency positions where that match is happening. It now happens, I'm pretty sure it's like mid to late May. And in fact, prior to that residency match day was taking place the day before graduation, which I actually didn't like that so much because I felt like it was really putting our graduates on edge just to find out the day before whether they've matched for residency. So now there's a little bit more like a month. So that's when most of those residency positions would be filled. However, there are some off-cycle. There are off-cycle residency positions that are open in the springtime. So, and those are actually more like, they're not unmatched, but it's kind of like that process where you're like applying for a job, and it's not as extensive as like the traditional application process.
Thank you.
Good question.
Thank you for that question.
Yeah. So Debbie,
Did
can you
Oh, I
tell us-
was going to say, I thought Chandler maybe had a question.
Oh.
No? Okay. Okay, great. Go
Debbie,
ahead,
you
Jody.
mentioned the curriculum vitae. What's the difference between a curriculum vitae and a resume?
Okay, that is another good one. And it's important that we talk about that because working on your curriculum vitae is something that we do during your first career advising meeting with the Career Center. So first I have a question for the group. I'm coming back with a question before I answer. Does anyone know the English translation of the Latin words curriculum vitae? Any guesses? No?
No.
Okay, no Latin linguists in the room. Okay, so the curriculum vitae means course of life. So just a little factoid for you. So to answer the question, I think a good way to differentiate between resume and CV are to think of the resume as describing your skill set for a position. And then think of the CV as representing what you have done. And I'll expand a little bit on that. So the resume is definitely geared toward industry, the nonprofit sector, as well as the public sector. Again, you would typically be applying for a position. So you would cater that resume to be specific to the position of interest. And then also in terms of the length, it's generally 1 to 2 pages. Certainly it can be a little longer depending on one's work experience. And then with the CV has more of a chronological feel to it. And that's not to say that the residency can't be chronologically organized too, but your CV emphasizes your education, your experience, and your qualifications. And it's basically like the standard in academia, medicine, and science. So most often as an ND, you would have a CV. Now, I guess having said that, if you were applying to a position, or maybe you have aspirations to do non-clinical work, because there are non-clinical career pathways for NDs, for example, working for a natural products or nutraceutical company, in that case, you may have more of a something that's more like a resume, or it could be a hybrid, like resume / CV, but also the CV tends to be lengthier than resumes. It grows over time. And I would say at this point in your career, you're probably going to have a CV that is, I'm going to say 1 to 3 pages in length. If it's any longer, I would want to work with you to condense it. And I do want you to know that the Career Center has a CV template that we share with our students to help you develop your CV. And I love helping students and alumni with their CVs. So that is an advising appointment that you can actually schedule specifically for that.
Good to know. Awesome. That's great. Any questions on the CV versus resume? Anybody? No? Because my next question is going to be to Allie. Allie, is there an alumni association available for alumni to join after graduation? And if so, is there a fee to join? Can you talk a little bit about that?
Of course. Yes, we do have an alumni association, and we have a wonderful alumni association board who is very, very active. They're very engaged, and they want to give back to students and alumni. One of the things we did was the alumni business club podcast. That was a good one because a lot of NDs, when they graduate, they want business tips, right? So that's one of the reasons we started that. There's no fee to join. And so after you graduate, we do have a Facebook group where you can ask questions, if you need recommendations for, you're looking for an oncologist in a certain area for a patient. These are all things that you ask in the alumni Facebook group. So that's those are a couple of perks. But yeah, there's no fee. As soon as you graduate, you're a part of it. It's just whether you want to be involved or not. And we really hope you do get involved, because there's a lot of great information and a lot of great networking with that too.
So I know the alumni come from are everywhere. So do they ever like meet in one area, once a year or what have you?
Yes. So we do an alumni reunion at the AMP conference, which is usually at the end of July. We also now, with our School of Nutrition, there's the ANA, so we'll do a meet and greet there as well. But throughout, especially this coming year, which is really exciting, the AMP conference is in Phoenix. So we're going to have a big, huge alumni reunion at the Biltmore. So yeah, but as we keep going, COVID kind of put a wrench in some of our meet and greets and networking opportunities, but we're getting them back on track. So yeah, so we would like to do them a couple times a year now, instead of just one big one, but we'll always have the big one at the AMP conference.
And I know that students, as they go through the program, graduate, become alumni, these are the closest friends you'll ever make, So I do know a lot of the alumni that have graduated together, or, have connected with students before they graduate, or the class before them. Really, really connect, stay in contact with each other quite a bit. So that's fantastic.
Yeah, and the alumni are very, very open to giving back. They know they've been there. They know what you're going through. So they're very, very happy to help give guidance and even just, some mentoring.
Very good. Do either one of you ladies have a federal work study that works in your department? You both
Yes,
do?
we both
Okay.
do. Yes.
Awesome. Okay. Okay.
Yeah, and then for federal work study, both offices have them available. It's a great opportunity to work part-time with a flexible schedule. So I've had federal work study student that worked 4 hours a week, and then the next quarter she only worked 2, just because of her schedule. So it's very flexible with your schedule. And then it's great working either with alumni or with career services for, learning the ins and outs, networking. Because if you work in for my office, you're talking to alumni.
Yeah.
On Debbie's side, you're learning about the careers and the ND job board, and so it's really, really great. Like I said, it's flexible, so we're willing to work with you. And then for federal work study, they, I don't know if, I guess, have you gone through kind of what, like it doesn't go, the money doesn't go straight to you, it goes towards your tuition. Right.
So Debbie, real quick, we have to appreciate everybody's time. We have about 2 more minutes.
Okay.
Debbie, can you talk real quick about what Allie mentioned, the ND job board? What is that?
Oh, absolutely. So the ND job board, it's currently called ND Job Link. I will tell you that the name will be changing in alignment with the renaming of our university. Some of you may know that on September 26th, we will become the Sonoran University of Health Sciences. So anyhow, the job board is being renamed Sonoran, I think it's Sonoran University, I should know that exactly, Career Link. I think the URL will be shorter, sonorancareerlink.com. But basically, it's a publicly available job board. It is one of the largest ND job databases in the country. It's certainly the oldest. It has been in place, I believe it's like maybe 2 decades, definitely for some time, well before my time with SCNM. it would be great for you all to go and check it out. Like you can
Yeah.
actually already start to see what those job descriptions look like. You can get a sense of salaries in particular areas of the US, certainly requirements. It's really great. It's very easy to navigate. You could even set up job alerts right now if you're just like, wow, I would just like to learn more and I want to see what jobs are available in the aesthetics area or in the endocrinology area in my state. So it's the URL right now. I don't know if it was put in the chat. Okay. You've got
Indeed job link. Is that right, Deb?
right.
Okay. Okay.
Exactly. Our graduates, our soon-to-be grads and our graduates use it extensively, and it's available to, it's public. So certainly it's available to anyone with an interest in that area. I also should say, with the renaming of the job board, we're planning to expand it to actually include nutrition jobs, because we do have nutrition programs. So, I mean, that could even be of interest to an ND. Maybe they have a very strong nutrition focus. There will be jobs with nutraceutical companies posted. So a lot of exciting changes that are happening, and certainly that will impact the job board.
That's fantastic. So definitely reach out to Debbie or Allie if you have any questions. Great information, ladies. This has been awesome. Does anybody have any last minute questions or that you're just burning to know? No?
I
Awesome.
feel like I have so much more to share with them.
Right,
I can't believe the hour's gone.
I know, see, yeah. So both of their email addresses are in the chat. So feel free to reach out to either one of them if you have any questions that we didn't answer today. But thank you, Allie. Thank you, Debbie. I totally, really appreciate you joining us today. Great, great information.
Oh, thank you, Jody, for
Right.
hosting, and for all of you for being here.
Awesome. All right. Have a great afternoon, everybody. Bye-bye.
Bye.